Hello, everyone. I see people are connecting now. Welcome. Maybe as always, I give like 1 or 2 minutes for more people to join. Okay, we have a couple more people, but still not um, full room. Maybe 1 more minute, if that's okay with everyone. Okay, I think we can get started. I don't see others joining. They will probably just join as we go. So welcome everyone, and thank you for joining today's SRS webinar. So today's session continues our discussion on resource mobilization, building on our webinar that we had in January, where we heard already from the country plans from Kenya, Pakistan, Senegal, and Tanzania. And today we are continuing with the presentations from Mali and Ghana teams. And following the country presentations, we will have also a guided discussion facilitated by the CDC Foundation. And I see already here Kingston Nathel. So thank you already. And that is aimed at drawing out practical lessons, challenges, and solutions related to SRS work and resource mobilization more specifically. So for that, we really encourage everyone to engage actively in the discussion, and maybe you came already prepared with some questions or challenges from your own SRS planning or implementation strategy and resource mobilization efforts. So I would say let us start with the country presentations now. I would like to give the floor to the Mali team for the presentation. I see Jason here. So Jason, the floor is yours.
All right, thanks. I'm going to go ahead and share my screen. Make sure that's on slide 1. Okay, let me know when you can see my screen.
We can see it.
Okay, great. Good morning, good afternoon, bonjour tout le monde. My name is Jason Bailey, and I will be presenting Mali's resource mobilization strategy for our SRS. What I hope to kind of relay today is that it's not just like a funding plan, it's like kind of more of a sustainability roadmap. It's designed from the beginning to transition from external support to full government ownership and providing in-kind cost contributions and other funding sources that are procured by the Malian government by 2030. So before I explain how we're going to mobilize these resources, I wanted to explain why we in the country of Mali needs an SRS and why the traditional CRVS investment didn't or won't solve the data gap as of right now. So Mali, right now, Mali registers about 7% of deaths, despite having over 1,500 civil registrars across 703 municipalities. And that results in 93% of deaths go completely unrecorded. Critically, Mali has never published a vital statistics report with continuous surveillance for health planning purposes. So basically, I want to, in my plan, in my proposal, I want to kind of relay why we shouldn't just invest more in CRVS. The answer is we've tried that already. The National CRVS Strategic Plan of 2018 to 2022 was budgeted at $79 million. The European Union launched a $25 million program, and this million euro program, specifically to modernize Mali's civil registration system. Between 2016 and 2018, death registration moved from 5.9% to 7.19%. That's a 1.3 percentage point improvement despite tens of millions of dollars in investment. So basically, if you were to look at that graph, at that trajectory, reaching 80% death registration would take over 100 years at that rate. So this is not really a criticism of CRVS investment. It's just a recognition that CRVS modernization at this point and vital statistics production are different objectives. CRVS builds infrastructure for legal identity, but health ministers need mortality data now to allocate resources. The SRS provides a parallel pathway to generate representative mortality data within 18 months, not 100 years. So obviously, we remain fully committed to CRVS strengthening, but the SRS fills a gap that CRVS alone can't address in any reasonable time frame. So I want to go over first the scope of design of Mali's SRS. So we're going to start with, it's going to be a modular system starting with core birth and death surveillance across 963 enumeration areas in the 5 southern regions plus Bamako. Strata are balanced urban-rural, and they're powered to achieve 15% precision on regional mortality estimates. Our surveillance approach combines 2 mechanisms. We have active detection through monthly household surveillance visits using Mali's existing community health worker network, and then passive detection leveraging community social networks. And this is your imams, your traditional birth attendants, your village leaders, anyone who naturally learn of vital events in their communities. Critically, our resource strategy builds on existing infrastructure. We're leveraging trained government health personnel, community hospital health facilities, and administrative systems already in place. We're also utilizing another Gates initiative called REACH. A lot of you already know about this. It's a massive countrywide investment, but that includes field vehicles, coordination offices, digital platforms, and personnel, representing about $1.5 million in existing infrastructure. Basically, what I'm trying to relay to you is that this integration approach means we're not building from scratch, we're just accelerating. So during phase 1, and this is 2026 to 2028, that is the rollout and demonstration phase. During this phase, we use the Gates investment combined with Malian government in-kind contributions to establish reliable vital events surveillance. Our focus is deliberately narrow and achievable: community-based birth and death notification and registration. We're not trying to do everything at once. We will generate high-quality birth rates and all-cause mortality rates, and that's data that Mali has never had from a continuous surveillance system, as I mentioned before. Equally important, we'll rigorously document completeness, timeliness, policy impact, and cost. This evidence base is essential for securing future domestic and international funding. We need to prove the system works before we can convince others to invest in it. So I'm going to briefly go through some rough numbers because I know that's what kind of matters for a resource mobilization talk. So phase one requires roughly $1.9 million across 5+ regions over 18 months. That's approximately $340,000 per region for full system setup and operations, about $2,000 per enumeration area. And that calculates down to roughly $20 per household monitored over 18 months. So where does money primarily go? The majority, 52%, goes to personnel and community networks that are already existing. Field operations, including vehicles and logistics, account for about 23%. Technology infrastructure is about 15%, training 6%, and coordination and administration around 4%. So the critical point for sustainability is that the Malian government is already contributing in kind through the CVD Mali estimates, which is the research arm of the Malian government, technical support, and as I said before, the Reach Mali logistics and personnel investment. That results in external funding needed is about $1.6 million, roughly. After phase one, the annual recurrent costs will drop by an estimated 35% to approximately $1.1 to $1.3 million. Obviously, that reduces going forward because we need to do the foundational research and all the things to set up these plans in places that we have not worked before. So here's the funding source power interest matrix. And you've seen this before. This maps potential funders by their power and influence. And you can see in the high power, high interest quadrant, our priority targets. Sorry, give me 1 second. Yep, our priority targets. The Gates Foundation, the government of Mali, UNICEF, World Bank, kind of the usual suspects. These are stakeholders that we must manage closely and engage continuously. Many of these organizations have mandates to assist with mortality surveillance and have contributed to these efforts in the past. In the high interest, moderate power quadrant, we have technical partners that provide agile technical support and have continuous feedback loops and adjustment when needed. Below the line, we have high power stakeholders with moderate current interest with the Global Fund, Gavi, African Development Bank, whom we need to cultivate and engage to raise their interest level. So basically, the plan with this is not to exactly approach any of these entities until we have really, really good data in hand. Data that has been demonstrated as high quality, thorough, and useful for policy driving efforts. So basically what we're going to do for the advanced funding landscape mapping, so we've identified the partners that we're going to talk to. And obviously this is not until after we've demonstrated the worth of the program. We're going to be mapping these funder profiles, right? So each of these funders is going to have a funder profile, which starts with thematic priority, meaning what is their general purview. What is their current presence in Mali? What efforts are they currently doing in Mali? Typical grant size, how they fund in the funding modality, what they fund, current Mali programs that they're currently funding, and how they fit in with SRS in terms of their mandates, what their data requirements are, funding windows, cycles, of when to apply for funding, how often, and then identifying key contacts within the organization. Then we're going to meet to discuss the framing strategy. How are we going to present the Mali SRS data to these funding entities? What is the timeline to make these decisions? And what are the co-financing requirements within each of these organizations? So we're going to implement a diversified funding strategy. So again, we're not going to approach any of these entities until we have data in hand that we can show them. for CRBS specific mechanisms, the World Bank, UNICEF, Plan International, Save the Children, and UNFPA all work in this kind of CRVS death birth registration field. And then we've got funders that have been known to fund statistical capacity building, and that includes the World Bank Trust Fund for Statistical Capacity, Paris 21, and United Nations Statistics Division. And then we also have your regional coordination mechanisms, which includes APAI CRVS and the African Development Bank. So we're going to be, these are strategic partnerships and not just passive funders. We're going to be actively engaging these entities with government leadership. As I said before, this is a government-owned program. This is not just a project that is going to be led by the Malian government. And this is, we put together a national SRS governance committee, which includes some of the Ministry of Health and another ministry that is in charge of CRVS activities. INSTAT is a government entity as the technical implementing agency. They deal with all the national statistics. As I said, the Ministry of Health, the MSDS participation for health sector linkages. We are going to be scheduling quarterly meetings with research mobilization agenda as a topic that we talk about every single time that we meet. And then we're also going to invite CRVS technical partners to these meetings to discuss regional best practices, technical standards, when they're going to share their birth registration expertise, and then also identify people within the World Bank ID 40 team to discuss digital integration support. We're also going to engage academic and research partners, and this is the University of Bamako for vital statistics research and the National Research Institutes for CRVS policy analysis. So our last thing is we're going to be really heavily engaged in advocacy, communication, and then also demonstrating value before we engage any of these technical and funding partners. For phase one, that's the demonstration. It's from 2026 to 2027. In the second quarter of 2028, we will publish our first vital statistics bulletin. That'll include regional birth rates, crude death rates by age and sex. We're going to do a comparison with DHS and census estimates. And then in year two, we'll do an impact report, which includes a registration completeness improvements that are documented, where we evaluate what has happened in year one, document where improvements can be made, implement those improvements, and then document the increase in performance so we can demonstrate how agile our platform is. We'll also publish our cost effectiveness versus periodic surveys so that we can really advocate for SRS as not a replacement for DHS, but a sister program. So between submitting the grant at and receiving the funding, we're going to establish a Mali SRS Research Mobilization Committee. We're going to complete the funding landscape mapping, which is CRVS focused organizations, and then enroll 3 staff in the Africa CDC Research Mobilization Training Program. Are there any questions? Thank you.
Thank you very much, Jason. That was very comprehensive. We have now, maybe we can take the questions while we have the discussion, if that's okay with you, because we would have now next up the team from Ghana to present, but I'm not sure if I can spot them among the audience. Dr. Ayaga, are you in the audience? Or Dr. Wisdom? Or any other from the team? If I might be wrong, but I don't think I can see them. Otherwise, I would suggest we move on with the webinar and move on to the discussion. And particularly, maybe you can take the questions now if there's any questions for Mali before we move on. It doesn't seem to be the case, but anyways, we are having now this discussion, so maybe if something comes up, we can take it up now. I think, Nathal, I see you have a question. Is that for Jason?
Yes, thank you. Thank you, Jason, for this comprehensive presentation. It's very thorough and very thoughtful, the way you're describing this endeavor, and it's very commendable. I only have one question. You described the platform you're going to use to support all this. I was wondering exactly what do you mean by the word platform? Is it a collection of organizations and institutions and including software and guidelines? It's not clear to me exactly what you mean by a platform in this instance. Could you please clarify? Over.
Absolutely. So we currently have a Gates investment that is deploying azithromycin across the entire country of Mali. And obviously that is a huge endeavor. That includes kind of doing a small census and then also the deployment and tracking, monitoring, and evaluation. And then other programs underneath that use kind of that infrastructure to deploy other interventions, right? And so the way that we plan this is to kind of in kind go with that same kind of structure. And so we're using and that's what I mean by platform. And if you, and I don't know if you were meaning digital platform, but I can describe that if that's what you meant. But I'll just finish with the Reach platform. So we're already working in the entire country, and then we've also done baseline mortality estimations for 5 of the regions. And so what this will do is will give us continuous surveillance ability and be able to compare those districts and those enumeration areas versus when those data were collected before. And that's kind of what I mean about a platform. This is underneath that whole umbrella of that countrywide intervention that will be going on for the next several years. So we're lucky in that we're already employing our health networks. We're already employing drivers and infrastructure and the statistical partners. We're already engaging all of these individual these partners, and we're just going to use them. And it de-risks a lot of this. There's a lot of this that we're not starting from scratch. And we are well integrated into the communities by way of these, frequent touch points with these other platforms. And now
Thank
I'll
you
ask
very much.
you meant software platform.
Thank you very much. That was very clear. And again, congratulations.
Thank you.
Thank you, Nathal, and thank you, Jason, also for the question and answer. If it's okay, we can move on now to the guided discussion that, as I said before, will be facilitated by CDC Foundation. So we can stay with you, Nathal, and with Kingsley. So I will, as I mentioned at the beginning, it's really intended to be interactive. We really encourage participants to share any reflections or concrete examples from your own contexts. So without further ado, I will give the floor over to you both, Nathaniel and Kingsley. Thank you very much.
Yeah, thank you, Patricia. I thought that Ghana was going to present, then we would do at the end, but it's fine to go by this way. Yeah, so just want to say thank you so much, Mali, for the presentation. We really have learned a lot. In the next few minutes, we would like to facilitate a guided discussion on resource mobilization. And the goal is really not fundraising, but rather kind of a peer learning, a learning opportunity, surfacing on what has worked, what hasn't, and what support countries need right now to strengthen their investment case. So I will pose few questions and invite let me try to find my share button, invite you to share your experiences. Like I said, this is just like a learning opportunity. So the first question that we would want to understand is, in your resource mobilization plans and discussions, what arguments have been most effective in making the case for investing in SRS, particularly with governments or funding partners? Like you have presented, you have listed all these external and domestic partners. So, Patricia, first of all, I want to find out from you whether this goes to only Mali or to all countries for them to share their experience.
It's really meant for all countries. I see, I don't want to put anyone on the spot here, but I see also, from other countries that are not maybe necessarily in the planning grant. So it's really, for those in the planning grant, but also maybe other countries which are further along their journey, their implementation journey. So it's really open to have like a rich discussion.
Yeah.
And maybe also be helpful to other countries that might be, let's say, struggling or just thinking about these specific questions. So really open to anyone, yes.
Sure. So I see Jason's hand up. Jason, please.
Sure. To get it started, you just heard me talk for about 20 minutes, but the best argument for SRS in the Malian context is that investment in the CRVS, like there was a huge investment of 25 million euros that happened between 2016 and 2018. And that resulted in only a 1.3 percentage point increase in death registration. And so SRS is an active surveillance, at least in our protocol, an active surveillance program. And with that, we work within the communities with known people in the communities, known, trusted, respected, and then also our community informants, the imams, and other civil registrars, to kind of get the best data possible in real time. And then we also have feedback loops to verify those vital events in, I'd say, about 10% of the cost to get actionable data. Over.
Okay, thank you for that, Jason. And I mean, that really resonates, that huge investment yielding 1.3% in debt registration. I mean, it looks on the low side. Yeah, so at this time, we would also invite other countries, Ghana, Pakistan, to share their experience. But some pros or some guide here is that it would be great if you mention the return on investments that you're anticipating, some of the efficiency gains, use of SRS beyond statistics, like we have heard, beyond for surveillance, for preparedness. Yeah, so if you could also, if countries could also share their experience around that, that would be very grateful. So I would invite other countries, Ghana, Mali, Ghana, Senegal, and also Pakistan, if they are on, or any other country wants to talk, to come on off mute and share their experience with us. I can't see who has his hand raised from here, but if anyone has his hand raised, go ahead.
Hello, good afternoon.
Good afternoon.
This is Kingsley, Ghana. Yes. First of all, Prof. Bawah was supposed to join. He had a class, he just finished, so he would join shortly to do a presentation on our behalf. Yeah. So that's the information he asked me to carry on, but he will join shortly.
Okay, so Kingsley, are you not able to respond to the question, or as a group, or as a country?
Okay, yeah. So I am from the CRVS wing, and the data we have as a registration unit has mostly come from the institutional devs. And so what we are seeking to do is to leverage on this system to have the community-based devs. And mostly we have had challenges with cost of dev information, mostly missing from the dev that we register for the community level. And so my expectation is that coming on to this SRS system, the registered dev are going to receive from the notifications that the SRS will provide us to be able to have accurate information from the sector. Yeah. So that is what I can say from our side as a CRVS institution on board.
Okay, thank you so much, Kingsley, for that. Any other country wants to share how their arguments have been most effective in making a case for SRS investment? Okay, we'll go to the next question. I'll invite Natayov to lead this question. Natayov, if you are ready.
Thank you, Kingsley. So the next question is, how countries aligning SRS with broader national priorities such as health system strengthening, CRVS reform, or global health security to attract funding and political buy-in? So this question is particularly interesting because the funding landscape is rapidly changing now around the world because of various reasons, and there are certain new emerging priorities. So SRS is not evolving in a silo. So the reason for this question is to probe what synergies can be found in other emerging priorities. So I would invite anyone who has ideas on this topic to chime in, please. Over.
Yeah, we have Pakistan, you have Kenya on board. I think we have too much silence here today.
Yes, I also see, I don't know if all the countries are present, but I see, as you said, yeah, Kenya and Tanzania and Mali and Ghana. So yeah, please don't be shy and maybe share whatever has been your experience. It doesn't have to be right or wrong, or maybe you do have another question related to this one, like whatever it's useful to you and you might want to share.
That's very important, yeah. Any experience you want to share so that it becomes a learning for others. I see that there are things going into the chat. Some people are saying it may be useful to type the question in the chat. Okay, we can just do that quickly. Do we have Pakistan on here to share some of their experiences?
I don't think I'm seeing any representatives in the audience from Pakistan.
Okay, we have the questions now in the chat. if French-speaking countries will need to kind of translate this, then that'll be easier for them to respond. But I also want to hear
Oh,
from Kenya.
we have French speaking countries.
I think Mali is.
Okay, but beside Mali.
Um, so that's the only country I know that speaks French.
Senegal, but I don't see also anyone from Senegal in the team, and we have money also to translate. So there's this other channel in French for anyone who's more comfortable with French. There's French translation.
Yes, so if anyone is more comfortable in French, they can speak in French, and I will gladly translate,
Sure.
initiate the conversation in French.
I haven't forgotten that I was a French speaker. Yeah. So that would also be great if you wanted to speak in French. But now, if you want to also pose a question in French so that they can respond to that.
Yes, so let me ask the first question, the first and second question we discussed so far in French. Alors, la première question, c'est quels sont les arguments les plus efficients pour convaincre les investisseurs d'investir dans le programme SRS, et en particulier le gouvernement ou d'autres bailleurs potentiels. Ensuite, la deuxième question, c'est comment les pays qui participent au programme alignent-ils leurs priorités nationales telles que le renforcement de leur système de santé et les réformes du système CRVS ou la sécurité globale pour attirer d'autres capitaux dans le programme SRS.
Thank you, Nata, for that. But in the first place, how many countries do we have here, Patricia, quickly? And probably if countries are not ready to kind of share experiences, we can give some tidbits on some of these questions.
Yeah, no, that's a very good idea. And then so from what I see Mali, I'm seeing Kenya, I'm seeing Tanzania, I'm seeing Ghana was here, but what Ghana. But I think that is a good approach. Maybe we don't want to put anyone on the spot, and you can share maybe your thoughts around those questions. And if anyone has any other comments or questions, they are always welcome to either post their questions in the chat or just raise their hands. And also maybe so Kingsley Kwekie, I'm sorry if I mispronounce that. Whenever Dr. Ayaga or yourself are able and willing to present Ghana's plan, please let us know if you're ready, and we can have like another 5 minutes or so of discussion, and then maybe move on to Ghana's presentation.
Yeah. Yeah. So Kenya, Tanzania, do you want to respond to this questions, these two questions, and share your experiences if you are comfortable? In the next few seconds, if you can come on mute, we just want to hear what experiences you have. It could even be you telling us a challenge that you are facing in this. Then we are all going to navigate or brainstorm as to some of the best practices that can help to resolve this. Okay, so around the arguments that have been most effective in making the case for investing in SRS, some of the tidbits here is it would be very great if countries phrase and structure their arguments around what return on investments that government and also funding partners will benefit from SRS. A key instance is that we need to communicate to our partners and also the government that SRS is being framed as a core infrastructure, but not as a project, because from experience, most projects that have happened in many developing countries, these projects are implemented, and when the project ends, usually sustaining the project or embedding the project into the national priorities becomes very difficult. So I will pause here because I already see Jason's hand up.
Sure, I would have waited until you finished. But so we just had our first meeting with the Ministry of Health and other ministries in Abu Dhabi a month and a half ago. And the most compelling argument for government interests and that they really resonated with was A, like you just said, this is not a project. This is not something that we do for a year or two, then leave. This is a government program that is owned by the government. And in Mali's specific text, there was some issues with ownership of the data, and I'll let you look into that online. Don't have time to go into that right now. But it's a problem with external entities going in, doing the project, and then having ownership of that data. And so this would be Malian owned and operated. Second, in the Malian context, in working in this in Mali for as long as we have, we've noticed that getting really accurate denominators for all of our, the populations, that was one of the key selling points that the Ministry of Health was extremely interested in, getting continuous denominators to then, have your vital events recorded to get actual numbers and rates that are not based on estimations. And so those were the two compelling things. And then also, obviously, the cost that I had mentioned before. And then also how SRS would influence CRVS and CRVS would influence SRS, and would go back and forth. When we would report our SRS numbers, we would compare them with CRVS and then have this information exchange between the two programs. Over.
Sure. Thanks so much, Jason. These are very practical points, and I'm glad that in your meeting in Abu Dhabi, this really came up. Yeah, I see Natef's hand raised. Natef.
Yes, thank you, Kingsley. Thank you, Jason. So in addition to what Jason said, I would want to offer some keys or food for thoughts for countries who are thinking about positioning SRS within the national priorities with sustainability in mind. So the first key is to align with SRS if possible, and it's suggestible to do it, align it with the global goals. So explicitly link SRS with the sustained development goals, for example, target 3.8 with a universal health coverage, for example, and a sustainable development goal 16 we will talk about inclusive societies. So the other key point is always try to embed a SRS in the budgetary process for the whole country. So make the case to work to move SRS funding from grant-based to a budget-based. So that's a good strategy as well. And finally, in regarding for system strengthening, it's always a good strategy to position SRS as a core component of health system strengthening, which contributes to economic positivity in the country and job creation in the health sector. Over.
Thank you so much, Natef. Any country wants to come off mute and also share some experiences. Some of the experiences could be from other projects, but applicable to SRS if countries do not have any direct response to this on SRS. It can be from your previous projects that you have done and how we could learn from that project and apply to SRS. Okay.
Can I share the experience for Tanzania?
Yes, please do.
Okay. So for our case here in Tanzania, the main argument was built around the sustainability as well as the data ownership. Beyond the use of the data that we have been missing for quite a long time, things like the availability of population level denominators and active the depth information from the sites. So the two things that I have mentioned, we had broader discussions and looking forward on how we could tackle them. We're going to tackle them through SRS implementation. So in terms
Great.
of the ownership, the government became to be convinced because we had built a case in such a way that we are going to implement the SRS using the existing health systems of the government, and particularly data is going to be managed using the government databases, existing databases, and the main people with access and who are going to be working with the team around are the people from the government itself. So the officials and the management felt to be 100% owning the SRS ahead of the implementation. So we had assured, and the ministry overall was assured that the data is going to be collected by the ministry, stored within the health systems of the government, and it is going to be managed by the government itself. Another point was around the area of sustainability, because many of the previous projects were 100% funded by the donors. So when the discussion came around the table, we had to ensure that the government has to deploy or use the existing personnel from the point of data collection, analysis, all the way till to dissemination of this information. And this went straight to the point of data collection, where we have been ensuring, and the government has accepted, that we are going to use the existing community health workers who have already been employed by the government, and as well as the supervisors at district, regional level. We're going to deploy those that are have been employed by the government, and going beyond that, even the infrastructure, things like existing tablets, computers at district to regional level, and all the way to national level are going to be used to the ones that are being owned by the government. So the government is happy, and it feels like it's the really something which is innovative and new, which is going to strengthen the health systems and even beyond that. So that's it. Thank you.
Thank you. Before Patricia, you come, what really echoes a lot to me from this discussion on making investment cases. I'm hearing countries seeing SRS being framed as a decision support and kind of a surveillance system or a systems to enhance the existing system, and not just as a data collection exercise that probably we will see in other settings. So this is really very helpful. Thank you, Kenya and Mali and Nataya, for also sharing these experiences. Patricia.
Yes, thank you. Thank you very much to everyone in Kingsley and Nathaniel for the questions, and for the country teams also for sharing their experiences. I think it's very enriching. And I see you also have, there's another two questions you prepared, but we are running a bit out of time, and we have, I believe, Dr. Ayaga from Ghana now ready to do the presentation. So I suggest we move on to Ghana's presentation. Thank you very much, Kingsley and Nathaniel, and maybe somehow we can share these questions also with the countries and move the conversation and the discussion offline. So maybe we can see how we can do that. But thank you very, very much for facilitating this interesting discussion. And also, likewise, if there's any questions from or like comments that have been maybe not able to share or that come up to your mind later on, we can also again move on the discussion offline, and you can reach out to me or to Kingsley and Nathaniel for that. But yes, so now without further ado, I see that we already have the presentation. We are seeing your notes, Dr. Ayaga, just if you, in case you want to change the view to the presenter mode.
Change it to what mode?
To presenter mode, because we can see now your, exactly there, swap presenter view and slideshow, the first option on your display settings. That one.
Yes, it's on slideshow. Is it okay now?
Swap. It didn't change. Now it's great. Perfect.
Okay.
Thank you very much.
Thank you very much.
Over to you.
And my sincere apologies. Sorry, I was teaching. The class got late, and I'm sorry, but so we are here. Thank you. As you all know, Ghana has made some progress. Still not much. 33% coverage in terms of completeness, and the system is fragmented. And of course, retrospective. The COVID-19 showed us that we needed something that will give us real-time data. What we usually rely on is these periodic surveys, and we are not able to monitor mortality, especially under 5 mortality. So, in view of that, we are poised to implement this program. We've completed the phase 1 planning, and we are ready to deploy in 8 regions. As we indicated, we are going to do a phase implementation. Ghana has 16 regions. We will start with 8, and then we progressively by year 3, 5, we would have completely implemented in the 8 regions. And the target is 1.7 million people under surveillance by year 5. We are adopting a cost-sharing model. At the moment, the value is it's about 10 million. We expect government commitment of 53% and donor support 47% as catalytic startup funding for this project. So we have a sort of risk share model, which we hope that the government will eventually take over. For our resource mobilization plan, we have, the framework utilizes a blended financial model that will pull resources from multiple sources. We will leverage existing institutional infrastructure and assets, target development partners and donors, mechanisms that we can leverage and ensure that we don't duplicate this. And eventually, the aim is to get this integrated into the government of Ghana budgetary allocations. Eventually, by the time that we are ending the program in year 5. Currently, there are a few national programs and structures that we are leveraging. As I've indicated in the past, Ghana is implementing a national identification card system that is going to be a game changer that will allow us to, piggyback the SRS on this. And once that comes to full stream, including everybody, this is going to help us to deal with issues of duplication. Ghana has the program of action to deliver health services in Ghana is based on the CHIPS model, community-based health planning services model, which spreads community health nurses across the entire country. Almost every village now, community has a nurse. And we're planning to use this as major resource to be able to conduct the verbal autopsies. Once deaths are reported, they will also, because they work in the communities and work with the community volunteers, they can, pick up events, births and deaths, and then we will also train them because of their medical training to be able to conduct the verbal autopsies to determine the causes of death. At the moment, we are being supported by the 3 demographic surveillance sites, and we hope to leverage that platform as a major contribution to the SRS in Ghana. We are already developing the system based on these existing structures, and we hope that we will be able to leverage this. For us at the University of Ghana, the Regional Institute for Population Studies, which is a premier training program in Africa on population programs, we hope to develop this as a center of excellence. That would then provide a lot of capacity and research anchor for CRVS reforms and scale up within the sub-region. That's what we are pushing ourselves to. The DIMS hopefully will be integrated into the SR module as these are currently our digital platforms. So we will hope to leverage these systems, and we are confident that this is going to provide a huge resource that would already take apart a lot more of the costs because these structures are already in place. For the funding, we are also looking at co-funding mechanisms, look at and try to do some strategic partnership alignments. We have mapped out the different donor mechanisms that are available and the different components that we think that specific different components of the SRS that we think that specific donors we can reach out to them to provide some support. So for instance, this program already we are going to get funding hopefully from the Gates Foundation to jumpstart this process. We have been dealing with UNICEF, and there are different programs that they are interested in, and much of what they will be needing, once this program is in place, it becomes a platform for us to generate data for them, and we hope to leverage resources from there. The World Bank, we will also leverage them, funds from them. They are interested in funding the reproductive health, maternal, newborn, and adolescent health plus and the nutrition programs. So hopefully we'll be able to leverage some additional resources from the Global Fund has priority funding for Ghana for different programs, and our colleagues from the Ministry of Health have indicated that these are areas that we can leverage. And of course, the USCDC is interested in health security and global health security. Once this program is on stream, it will provide a lot of information for early warning system, which will be something that we can reach out to the Global Fund to support, so that we can also support them with the needed data. In the long term, we expect that we will migrate from donor dependency into a domestic ownership, and principally we will look at getting some earmarked funding, exploring funds from the Ghana Trust Fund, which is the Muhammad Care, NDC, NCD surveillance. The Mama Care is providing. The president has provided resources for non-communicable diseases, which is becoming a major problem, and there's funds that are dedicated for that. Once this program takes off, we should be able to make a case for us to leverage that because it will provide, a platform for monitoring some of this. Eventually, we will expect that this will be integrated into government funding with budgetary costs or budgetary allocations for salaries, supplies, and other requirements that will make the project function. For instance, I had a meeting with the Director General of Ghana Service. They just moved their headquarters from where they have been to a new building, and they've set up a huge data center with more than 30, machines, high-end machines for monitoring, for doing mortality monitoring, and this is going to be a major contribution for this project. Real-time mortality monitoring. So I met the Director General arranged a meeting for me to meet with the director in charge of that program, and hopefully we are very excited that this is already going to be a major contribution to the project. To make it sustainable and make sure that there's ownership, we've put together a steering committee at the high level. Of course, as I said, the university will provide a technical lead and will provide space for project secretariat, for the policy implementation bit, the Ministry of Health and Ghana Health Service already as part of this, and of course, the research centers which are part of that will become, the hubs for policy implementation operations. Eventually, Ghana Statistical Service, who are responsible for the sampling, will also provide technical support for some of the data quality issues, data monitoring, and hopefully we will also leverage on funds from other government institutions. So what is our next steps? We have identified 4 clear next steps. The initial thing is to get a domestic commitment. We've been having meetings with the various sectors to make sure that this comes on stream. Hopefully, if we secure this grant, then that is going to jumpstart the process and put us in a position to start this process, and eventually we will then see how we'll eventually align other donors to come on stream and support, and eventually this will be offloaded as a full government funded program. We are still having stakeholder meetings. As I said, I had a meeting last week with the Director General of Ghana Health Service and the director responsible for the Mortality Surveillance Center, which they just established. And they have made their commitment to make sure that this become part of the mechanism to support this process. So we are at a point where we are poised to do this, and hopefully we'll get it done. This is going to be a major high value investment. We hope that once this is implemented, it will support how we respond, the country respond to what it makes, and how it enables the country to be able to accurately monitor the SDGs and then eventually save lives. So we look forward to a positive evaluation of our proposal, and then we'll get off the ground and make sure that we deliver on this. Thank you very much.
Thank you very much, Dr. Ayaga, for this comprehensive and presentation. Unfortunately, we run a bit over time, so I suggest if there are any questions to the Ghana team, please do reach out to them directly. I'm also very happy to connect everyone in case the emails are not shared yet. But thank you very much, Dr. Ayaga, and also Jason for the presentation, and especially also to Kingsley and Nathael for facilitating the discussion. And I'm sure we will be able to think of a way of continuing this offline. And yeah, so without going much over time, I appreciate everyone's active participation and contributions. And I thank you again for your time and look forward to upcoming sessions. And please do not hesitate to reach out if you have any comments or questions. Thank you, everyone, and have a good day still.
Thanks, everyone.
Thank you.